everyone, my name is Ishaana and today I'm going to be talking about non-communicable diseases and the use of AI. So a little bit about me before we begin. I'm currently a rising senior at South Brunswick High School in New Jersey. At my school, I serve as the president of the SB Hosted chapter. I'm also a founder of a nonprofit tutoring organization, and I'm also a volunteer with the American Red Cross as well as some hospice and senior centers, and in the future, I intend to become a dermatologist. So a little overview of NCDs and what they are. So NCDs are known as non-communicable diseases. So when we say this, we mean that they cannot be communicated from one person to another, or they're non-infectious. And these diseases are also known as chronic diseases as they're usually long-lasting and progress gradually, so they require long-term treatment plans and care. And NCDs are currently an increasing global health threat and the leading cause of death worldwide, which is why they can also be referred to as the epidemic of our age. They can be caused by four main factors. This is genetics, physiological, environmental, and behavioral. And they're most often associated with older age groups. And they also target people in low and middle income countries and those people are just more severely impacted by NCDs. And it's been proven by the World Health Organization that roughly 31.4 million deaths occur in those LMICs. And some common risk factors include poor diets and lack of physical activity, harmful use of substances and alcohol, and air pollution. And these factors are all known as metabolic risk factors, which start becoming prevalent early on with increases in blood pressure, blood glucose, or blood lipids. And there's also environmental risk factors. So that includes mostly air pollution, but this causes stroke, heart disease, obstructive pulmonary disease, and lung cancer. So some examples of NCDs, there are four main types. First is cardiovascular disease, so this includes heart attack, stroke, coronary artery disease, and much more. And cancers, the most common in men are lung, liver, and stomach, and the most common in women are breast, lung, and cervical. There's also chronic respiratory disease, so this includes chronic obstructive pulmonary disease or COPD, which is just an inflammatory lung disease. There's also asthma and pulmonary hypertension, which is high blood pressure that specifically affects the arteries in the lungs and the right side of the heart. And lastly, there's diabetes, and this is when the body cannot produce enough insulin, and thus the amount of blood sugar and glucose cannot be regulated. So we have type 1 diabetes and type 2 diabetes. But ultimately, these main types of NCDs account for over 2/3 of deaths globally. So some stats and quick facts about NCDs. NCDs contribute to around 74% of deaths globally, or 41 million people per year. And this is the same as saying 7 in 10 deaths globally. And nearly 17 million die yearly from NCDs before the age of 70. And the WHO has actually confirmed that 77% of deaths from NCDs are from the LMICs that I had mentioned earlier. And the four main groups of NCDs that we just mentioned they account for over 80% of all premature deaths. And cardiovascular disease accounts just only for 17.9 million deaths yearly. However, for treatment for NCDs, we can use AI. So there's a company that's getting a head start in this, and they're known as TechRx. So TechRx is able to diagnose and detect NCDs early on with a combination of smart AI and healthcare. So they utilize machine learning algorithms which analyze vast data sets, medical records, and genetic information, and lifestyle habits. So this just helps identify patterns, trends, and much more that allows healthcare professionals to detect the problem early on. And they tailor specific treatment plans to individual patients. So they take into consideration unique genetic factors, composition, lifestyle choices, and environmental factors. So thus, there's a high degree of personalization, which allows for the best and most effective treatment and intervention plans. So with that, patients will also become more committed towards a recommended treatment plan, and that can just help reduce the effects. And TechRx actually came out with a wearable technology that has remote monitoring tools. So it allows individuals to gain control over their own healthcare, and these wearables will collect health data in real time through AI algorithms. So patients can measure their own vitals, medications, and lifestyle factors on a daily basis. And that will just allow them to visit the cardiologist and hospitals much less. There's also another company known as AstraZeneca, and AstraZeneca is a multinational biopharmaceutical company, and they are dedicated to transforming the future of healthcare and unlocking the power of what science can do for people. So we may know AstraZeneca through the use of the COVID vaccine, but they have also done research in cell therapy, cancer treatment, and so much more. So in terms of NCDs, they launched the AstraZeneca Young Health Program, and this has educated and empowered the younger generation to make lifestyle choices which can prevent NCDs. But with the use of AI, they actually utilized AI to facilitate large-scale data analysis and interpretation to detect for NCDs. They actually partnered with a new AI company known as Cure.ai and created an innovative and more accessible technology which has the ability to identify high-risk anomalies that may need follow-ups. So for example, they just came out with a chest x-ray that utilizes AI known as QXR, and same for their head CT scan known as QER. So ultimately, AstraZeneca and Cure.ai have collaborated to change healthcare delivery and solutions and facilitate the adoption of this new technology among professionals and healthcare systems. So some key takeaways for the future. NCDs are not communicated through infectious agents, so they can only be caused by 4 main types of factors. That's environmental, lifestyle, and physiological. And actively maintaining a healthy diet and engaging in more physical activity and limiting the use of harmful substances can all reduce the risk of NCDs. So if we continue to support and invest and put more funding into AI treatment, we can actually benefit the future of NCDs, because AI has been able to analyze various data of patients and diagnose any conditions early on. So allowing for improvements that will enhance reliability and technology will allow for the reducing risk for NCDs. And like I mentioned before, AstraZeneca is a leading global pharmaceutical company, and they're actively addressing NCD prevention and management through AI partnerships. So just supporting these big pharmaceutical companies can actually take us a long ways. These are my references. And I just want to take the time to thank the Global Health Leadership Conference at Johns Hopkins University. And if you have any questions, you can email me right over here or connect with me on LinkedIn. Thank you.